Hey there, I'm Dr. Sarah Mitchell, pharmacist for over 20 years and founder of Bone Health Plus. I'll never forget the day Mrs. Wilson came into my pharmacy. She just received shocking news from her doctor, severe osteoporosis at only 58. She handed me her prescription for bone medication, tears welling in her eyes, and asked, "How did this happen?" "I exercise, eat well, take my calcium." What she didn't know, and what her doctors hadn't told her, was that the blood pressure medication she'd been taking for 15 years was silently weakening her bones. That day changed how I practice pharmacy forever. And it might just change how you think about the medications in your cabinet right now. You know, it's ironic. We take medications to help our bodies, to treat conditions, to extend our lives. But some of the most commonly prescribed drugs might be secretly compromising our bone health. And the worst part, most doctors and pharmacists aren't talking about it. I'm not here to scare you. I'm here to empower you with knowledge that could protect your skeleton for decades to come. Because here's the truth, many of us will be on some type of medication for years, even decades of our lives. Shouldn't we understand all the potential effects these drugs might have? Before we dive into specific medications, let me share some sobering facts. 1 in 2 women and 1 in 4 men over age 50 will break a bone due to osteoporosis. That's right, half of all women. And here's what keeps me up at night. Studies suggest that up to 30% of osteoporosis cases may be influenced by medication use. When I graduated pharmacy school, we barely discussed medication-induced bone loss. It was a footnote, a rare side effect. Now, 2 decades later, I realize it's a silent epidemic. Think about it. We've got an aging population taking more medications than ever before. The average American over 65 takes 4 or more prescription drugs daily. That's a lot of opportunity for drugs to interact with your bone metabolism. Let me be clear, I'm not suggesting you stop taking prescribed medications. That could be dangerous, even life-threatening. What I am suggesting is that you become informed, proactive, and partner with your healthcare providers to protect your bones while managing your health conditions. Let's start with the biggest offenders, corticosteroids like prednisone, cortisone, and dexamethasone. These medications are incredible at reducing inflammation and treating conditions like asthma, rheumatoid arthritis, lupus, and inflammatory bowel disease. But they come with a significant cost to your skeleton. I remember working with James, a 42-year-old with severe Crohn's disease. He'd been on prednisone for nearly 3 years when he fractured his wrist after a minor fall. The bone density test that followed showed he had the bones of a 70-year-old man. No one had warned him about this risk. Here's what happens. Corticosteroids directly interfere with bone formation in multiple ways. They decrease calcium absorption from your gut, increase calcium loss through your kidneys, and directly impair the cells that build bone. It's a triple assault on your skeleton. The research is clear. Bone loss begins rapidly, within the first 3-6 months of corticosteroid use, and fracture risk increases by up to 75% in the first year. The higher the dose and the longer you take it, the greater the damage. If you need these medications, and many people absolutely do, there are protective strategies we'll discuss later. But awareness is the critical first step. If you're on prednisone or another steroid, especially at doses above 5 mg daily for more than 3 months, your bone health should be actively monitored and protected. Let's talk about something sitting in medicine cabinets across America: acid reducers. Proton pump inhibitors, or PPIs, like Prilosec, Nexium, and Prevacid, and H2 blockers like Pepcid and Zantac. These medications are fantastic at reducing stomach acid for conditions like GERD, acid reflux, and ulcers. But your stomach acid serves an important purpose. It helps you absorb calcium, the fundamental building block of bone. I'll never forget counseling Maria, a 55-year-old teacher who'd been taking Nexium daily for over a decade. When she mentioned she'd recently broken her ankle stepping off a curb, alarm bells rang in my head. Her doctor had never connected her long-term PPI use with increased fracture risk, despite clear evidence in the medical literature. Studies show that people taking PPIs for more than a year have a 30% higher risk of hip fracture. After 7 years of use, that risk jumps to 92% higher than people not taking these drugs. That's nearly double the fracture risk. What makes this particularly troubling is how many people take these medications daily for years, even decades, often without regular reassessment. They're so effective at relieving symptoms that both patients and doctors are reluctant to stop them. But here's something many doctors won't tell you: most people don't need to be on PPIs indefinitely. Guidelines actually recommend using the lowest effective dose for the shortest duration possible. If you've been taking these medications daily for more than a year, it's worth discussing a reassessment with your doctor. This next category is particularly difficult to discuss because these medications are absolute lifesavers for many people. SSRIs like Prozac, Zoloft, and Lexapro have revolutionized the treatment of depression and anxiety. But research has uncovered an unexpected side effect: they may weaken bones. I remember consoling Rebecca, a 48-year-old who'd been successfully managing her depression with Lexapro for 8 years. When she fractured her hip after a minor fall, she was devastated and confused. "I thought this only happened to elderly people," she told me. The science here is complex but fascinating. Serotonin, the brain chemical that these drugs affect, also plays a role in bone metabolism. By altering serotonin levels, SSRIs appear to increase the rate of bone loss and raise fracture risk by 60–70% in some studies. This presents a real dilemma. Depression itself is associated with bone loss and increased fracture risk. So is the bone loss from the depression or the medication? It's likely both, creating a challenging situation for patients and providers. If you're taking an SSRI, especially if you're a woman over 40, please don't panic or stop your medication. Mental health is crucial. Instead, talk to your healthcare team about additional bone protection strategies and appropriate monitoring. If you're one of the millions of Americans taking warfarin to prevent blood clots, this section is particularly important for you. Warfarin works by interfering with vitamin K's role in blood clotting. But vitamin K has another critical function in your body. It helps regulate calcium and build bone. By blocking vitamin K, warfarin may inadvertently impair bone formation. I recall working with Harold, a 72-year-old on warfarin for atrial fibrillation. When he mentioned his height measurements had shown he'd lost nearly 2 inches in 5 years, I suspected vertebral fractures from bone loss. His doctor had never connected his long-term warfarin use to potential bone problems. Research suggests long-term warfarin users may have a 25% higher risk of fractures, particularly vertebral fractures, which can cause that. Characteristic height loss and stoop posture we often attribute just to aging. The good news: newer blood thinners like apixaban, rivaroxaban, and dabigatran don't appear to have the same effect on bone. If you've been on warfarin for years and have other risk factors for osteoporosis, it might be worth discussing with your doctor whether one of these alternatives could be appropriate for you. Diabetes and bone health have a complicated relationship. Type 2 diabetes itself increases fracture risk, despite often showing normal or even higher bone density on tests. It's about bone quality, not just quantity. Certain diabetes medications may compound this issue. Thiazolidinediens like pioglitazone have been shown to accelerate bone loss and increase fracture risk, particularly in postmenopausal women. I remember counseling Diana, a 61-year-old with type 2 diabetes who had been taking pioglitazone for 5 years. When she mentioned her doctor had found significant bone loss on her recent DEXA scan, I wasn't surprised, but she was shocked. No one had mentioned this potential side effect when prescribing the medication. The research shows women taking these medications may have up to a 2-3 times higher risk of fractures. For men, the risk appears lower but still present. Other diabetes medications like metformin may actually have a neutral or even beneficial effect on bone. This is why medication choices should be individualized, taking into account all health factors, including bone health. If you're taking thiazolidinediens and have other risk factors for osteoporosis, talk to your doctor about whether your diabetes management plan can be optimized to protect both your blood sugar and your bones. For people with epilepsy and certain pain conditions, anti-seizure medications are essential. But some of these drugs, particularly older ones like phenytoin, phenobarbital, and carbamazepine, can significantly impact bone health. These medications affect how your body processes vitamin D, which is crucial for calcium absorption and bone health. Long-term use can lead to vitamin D deficiency, decreased calcium absorption, and accelerated bone loss. I'll never forget meeting with Sam, a 38-year-old who'd been on phenytoin since his teens for epilepsy control. He was shocked when he broke his ankle playing casual basketball with friends. The fracture led to bone density testing, which revealed early osteoporosis, extremely unusual for a man his age. Research suggests people taking these medications long-term have up to a 2-6 times higher risk of fractures. The longer you take them, the greater the risk. Newer anti-seizure medications may have less impact on bone, though research is still evolving. If you've been taking older anti-seizure drugs for years, especially if you have other risk factors for bone loss, discuss with your neurologist whether newer alternatives might provide equal seizure control with less bone risk. This category affects millions of people, particularly those with hormone-sensitive cancers like breast and prostate cancer. For women with breast cancer, aromatase inhibitors like anastrozole, letrozole, and exemestane are life-saving drugs that dramatically reduce cancer recurrence. But they work by nearly eliminating estrogen, the hormone that helps preserve bone mass in women. The bone loss from these medications is rapid and severe, up to 7-8% in just the first year of treatment. That's several times faster than the normal rate of bone loss after menopause. For men with prostate cancer, androgen deprivation therapy that lowers testosterone can cause similar rapid bone loss, up to 4-5% in the first year. I worked with Elaine, a 59-year-old breast cancer. survivor taking an aromatase inhibitor. She was diligently following her cancer treatment plan, but had no idea it was severely impacting her bone density until she fractured her wrist while gardening. Her oncologist had focused on beating the cancer, which was absolutely the priority, but bone protection had fallen through the cracks. If you're on these therapies, bone protection isn't optional, it's essential. Most oncologists now recommend baseline bone density testing before starting these drugs, with regular monitoring and often preventative treatments to protect bone during cancer therapy. Now that we've covered the major medication categories that can affect bone health, let's talk about what you can actually do about it. Because knowledge without action isn't power, it's just anxiety. First and foremost, never, ever stop a prescribed medication without consulting your healthcare provider. The condition being treated often poses greater immediate risks than the potential long-term bone effects. Instead, follow these steps. 1. Take inventory of all your medications, prescription and over-the-counter. Make a complete list including doses and how long you've been taking each one. 2. Identify any bone-affecting medications from the categories we've discussed. 3. If you're taking any of these medications, especially long-term, talk to your doctor about appropriate bone health monitoring. This may include bone density testing, vitamin D level testing, calcium intake assessment, fall risk evaluation. 4. Implement bone protective strategies. Ensure adequate calcium intake, preferably from food sources like dairy, fortified plant milks, leafy greens, and canned fish with bones. Optimize vitamin D levels. Most adults need supplementation, especially in northern climates. Engage in weight-bearing and resistance exercise at least 3 times weekly. Avoid smoking and excessive alcohol consumption. Address fall risks in your home and environment. 5. Discuss medication alternatives or bone protective medications if appropriate. For example, if you're on long-term corticosteroids, guidelines recommend bone protective medications like bisphosphonates for most adults. If you're on aromatase inhibitors or androgen deprivation therapy for cancer, bone protective medication is often recommended. If you're on PPIs, long-term, periodic drug holidays or dose reductions might be possible. 6. Consider working with healthcare providers who specialize in bone health, such as endocrinologists or rheumatologists, particularly if you're at high risk. I want to share Sophie's story as an example of how this approach can work. She was 62, taking prednisone for rheumatoid arthritis, a PPI for reflux, and had just been diagnosed with early bone loss. Rather than feeling helpless, she partnered with her healthcare team. They added a bone protective medication, optimized her vitamin D, adjusted her PPI to the lowest effective dose, and developed an appropriate exercise program. 2 years later, her bone density had stabilized despite continuing the prednisone she needed. The key was awareness, proactive monitoring, and a comprehensive bone health plan. Before we conclude, I want to emphasize that pharmaceuticals aren't only bone villains. Many medications actually protect and strengthen bones. If you've been diagnosed with osteopenia or osteoporosis, especially if you need to continue taking bone-affecting medications, there are excellent treatment options. 1. Bisphosphonates like alendronate, ricedronate, and zoldronic acid can reduce fracture risk by 40–70% in high-risk individuals. 2. Rank ligand inhibitors like denosumab can significantly increase bone density and strength. 3. Anabolic agents like teriparatide and abaloparatide actually stimulate new bone formation, not just prevent loss for. Newer medications like romosozumab use innovative mechanisms to both increase bone formation and decrease bone breakdown. The field of bone health has advanced dramatically, giving us powerful tools to protect and even restore bone when necessary. If you're at high risk due to medications or other factors, don't hesitate to discuss these options with your healthcare provider. As we wrap up this deep dive into medications and bone health, I want to return to Mrs. Wilson, the patient I mentioned at the beginning. After discovering the connection between her blood pressure medication and bone loss, we worked with her doctor to switch to a bone-friendly alternative. We implemented a comprehensive bone health plan, including appropriate medication, supplements, and exercise. 3 years later, her bone density had improved by 4.8%, defying the usual downward trajectory for someone her age. That's the message I want you to take away today. Knowledge is power, and bone loss is not inevitable, even if you need medications that might affect bone health. I believe everyone deserves to understand the full effects of the medications they take. You deserve healthcare providers who consider the whole picture of your health, not just the condition being treated, but all the systems of your body, including your precious skeleton that supports you every day. If you're taking any of the medications we've discussed today, I encourage you to have a conversation with your healthcare provider about bone protection. Print out this video's companion guide from our website. It includes a medication checklist and questions to ask your doctor. And remember, your bones support you for a lifetime. They deserve your attention and protection, especially when medications might put them at risk. Thanks for spending this time with me today. I'm Dr. Sarah Mitchell for Bone Health Plus, reminding you that knowledge about your medications isn't just about being informed. It could be what keeps you standing strong for decades to come.